Okay, COVID-19 pandemic, besides day camps, we know it's impacting all of our lives.
But we also know it's having a disproportionate effect on families of color and low-income families. The pandemic is magnifying these health disparities that have been around for a very long time here. And here to talk about the impact on these families and their kids is Dr. Gigi Chawla, Chief of General Pediatrics at Children's Minnesota. Dr. Gigi, thanks for being here this morning.
Thanks for having me.
So even just the COVID cases, we know that Black Minnesotans and Hispanic Minnesotans are overrepresented in those numbers, but this goes far beyond that.
Oh, absolutely. It's really devastating to see the data. You know, looking at the health department data, you can see the disproportionate majority of cases are really in the Black African American community, and we can see that in our own children's pediatric data as well. I think there's lots of underlying issues for why that occurs. You know, certainly the underlying health concerns that some African American adults may have: diabetes, asthma, heart conditions, heart disease, obesity. Some of those conditions put them at greater risk when they do have COVID for having a detrimental health care outcome. And those health conditions really are health conditions that are due to socioeconomic drivers, not really inherent genetic issues all the time.
You're talking about the impact on adults, but we do know that even that then has an impact on the children there. How is COVID-19 affecting children in these communities?
Yeah, you know, I think the real challenge here and why we're seeing such high rates in our pediatric population as well is really, you know, the adults are often essential. They have essential jobs, and so it puts them at greater risk, and they transmit that risk to their children. African American families and people who live in poverty often live in housing situations where they can't socially distance, and they live in multi-generation homes, so that entire households and generations are then potentially affected. We can absolutely see that what we're creating and what we have the potential to create could be part of the solution or could also be part of the problem. So things like virtual visits for pediatrics could certainly reach out to many children, but it could also disproportionately reach out to kids who have means rather than kids who are underserved.
Right.
Immunization rates also,
right.
And so we worry about all of that.
We know these inequities are systemic. We know they've been around for a very long time. What are we doing about it?
Yeah, I think the very first thing that we all must do, and you know, healthcare is just another example in our community today of where we've got racial disparities, is we've got to listen. We've got to give people a voice who don't have a voice, and then we have to create our solutions to really make sure that we're managing to that population. And so at Children's, we do that with Community Connect, where we serve 2,000 patients each year that have needs and resources to meet. But we hope every business is doing the same to reach out to the underserved.
And continue to do so after COVID-19. Dr. Gigi, thank you so much for coming in today. We really appreciate it.